If you're a healthy person living in a non-outbreak area, the recommendation is to avoid travel to disease outbreak areas, generally stay away from crowded places, and stay at least 6 feet or 2 meters away from anyone with symptoms. Wearing a surgical mask is not recommended because they're meant to catch droplets from a cough or sneeze going out, rather than preventing you from breathing in the virus. Similarly, wearing an N95 mask is not recommended because they're only meant to be worn by healthcare workers. In addition, cleaning and sterilizing frequently touched surfaces like toilet seats, door handles, phones, and keyboards is also a good idea. As always, careful hand washing is key, and it should be done with soap or alcohol-based hand sanitizers and scrubbing for 20 seconds. Also, avoid touching your eyes, nose, and mouth. This is the area known as your T-zone. It's a common entry point for viruses into the body. For healthcare workers who are around people with COVID-19, the recommendation is to apply droplet and contact precautions. That includes wearing personal protective equipment like a clean, dry surgical mask, gloves, long-sleeved gowns, and eye protections like goggles or a face shield. When performing a procedure that generates aerosol, like tracheal intubation, bronchoscopy, CPR, or non-invasive ventilation, it's important to wear an N95 respirator. This prevents 95% of the small particles, like respiratory droplets, from passing through. Alright, as a quick recap. The SARS-CoV-2 virus causes COVID-19. The virus travels in respiratory droplets and enters the body via the mouth, nose, or eyes. It can cause symptoms like fever, cough, and shortness of breath, and in some people, it can progress to more dangerous complications like pneumonia, ARDS, and shock. The highest risk is among the elderly and those with other serious health conditions. Treatments are focused on supportive care, but medications like remdesivir are in clinical trials, and there's a vaccine in clinical trials as well that will likely be ready by 2021. In the meantime, the best strategy is prevention. This includes careful hand washing, avoiding traveling to disease outbreak areas and crowded places when possible, avoiding touching your T-zone, and if you're a healthcare worker, using personal protective equipment.